The necessity for advanced anesthesia services back in Connecticut prompted and actually introduced general anesthesia to dentistry and medicine over 200 years ago. Now, 200 years later, not only is it a specialty, a recognized specialty, but also we have many students applying to become dental anesthesiologists. Stay tuned as we talk to a D4 student who just matched at his top dental anesthesiology program. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, surviving dental school, getting into residency, surviving residency, and then life as a new dentist. Guys, make sure that you're subscribed down below and also hit those bell notifications. See that notification right there? Make sure you hit that so that you know when new videos are being released on a weekly basis. Also, this episode of Ask Dr. Darwin is being brought to you by Dr. Darwin On Demand. Dr. Darwin On Demand, the ultimate exclusive membership community for new dentists as in pre-dental students, current dental students, residents, new dentists out 5 years or less, and also international dentists looking to become licensed here in the US. A lot of camaraderie, a lot of tips, a lot of information. We have a weekly Q&A and also a monthly mastermind. So for more details, go down below and hit the link at thenewdentistcoach.com/on demand. And we'll see you in the network really soon. All right, guys, today we have special guests and we have some celebration to do. Not only is he my fraternity brother, but also a great guy and a great guy who's been rewarded with matching at his top residency specialty. Today we're going to be talking to student doctor Lee Goodloe, who is getting ready to. He's got his countdown on right now. He's counting down. We got about close to 30 some days before it's official. Well, he'll be known as Dr. Lee, Dr. Lee
Yes,
Goodloe. So,
yes,
welcome
yes.
to the show, man. How you doing?
I'm doing pretty well. I'm doing pretty well. Let me give you the actual rundown. It's 34 days, 12 hours, 33 minutes until the graduation day. So I'm
The
counting down the seconds.
countdown is for real, y'all. It is for real. Absolutely. Absolutely. Well, tell us a little about yourself, especially for those that are meeting you for the first time.
Sure. My name is, of course, Lee Goodloe. I'm a fourth year dental student. I got 34 days remaining until I graduate. I'm originally from Arkansas, Pine Bluff, Arkansas, where I pledged Omega Psi Phi Toxic chapter. Shout out to the good brothers down there. I spent some time floating around in dentistry. I was a dental assistant before I came to dental school. I was a dental hygienist, and now I'm in my fourth year of dental school, ready to become a doctor.
Well, man, you right there. You're knocking on the door, bro. You're knocking on the door. So let's dive into it because it's a lot of material that I want us to go through because there's people out there like yourself that are interested in this specialty. So, why dentistry? Why did you pick dentistry? I know you mentioned that you were a dental assistant and also a hygienist at one point, but what kind of made you pivot from those careers in the profession to becoming a dentist?
Well, good question. I started as an assistant to try to get an understanding of what it's like to be a dentist or what dentistry actually provides to patients. And so once I got the understanding of what dentistry can provide to individuals, I knew that there was a need. There was a need in not just the African American community, but all communities. You know that people have access barriers to care, and people have not been well educated about how the teeth is connected to the whole body. And so, armed with that information, I understood that there's a need um, for people to receive the care that they need, and also how can I deliver that service to the people. So, yeah.
Well, that makes sense. That makes sense. And your experience leading up to, I'm sure, was all part of a plan, a master plan to get you there. And one of the things that you mentioned That's a great segue to my next question is the fact of access to care and even those that have access to care, some of them still don't go, right? And one of the reasons why they don't go is because they're scared. They're
Right.
fearful.
Hmm.
Fearful of the dentist, fearful of the shot, the anesthesia, uh, the noises, whatever it is, for whatever reasons. And that's why I really like this specialty that you're getting ready to get into for anesthesia. Tell us a little bit about why you picked anesthesia as a specialty versus all the other ones that are most, the most popular ones like ortho and oral surgery and even pedo right now. Why anesthesia for you?
So, as I mentioned before, I've been in dentistry for quite a while. So, my dental career started back in 2000, probably 2007. But as a dental hygienist, I had really had a connection with the patients that I was providing care to. And many of them would convey to me that, they really fear, they'll come and say, I really hate you. I'm just like, whoa, that's a strong word. But it
Right.
really, to get an understanding of the person, they really hated what they had to go through in order to receive the care that they justly deserve, right? So they really hate coming to the dentist for several things, for several reasons, because maybe they had anxiety, maybe they home care wasn't necessarily adequate, and so they needed more than just preventative therapy. They needed, um, restorative procedures to be done.
Makeovers, complete makeovers.
Well, yeah, full mouth makeovers. And so, I mean, that will cause a great deal of anxiety. And so, when patients convey that to me, though, I can recommend the things that is in my wheelhouse. So I can tell them, bring some music so you can kind of take the edge off. And if that wasn't enough, then I can go to the dentist and say, hey, this patient needs more than a little bit, more than more than music. So let's give them some nitrous. Would nitrous be available to them? And if they need more than that, what about Valium? And so some of those things work for most patients, but some patients their scope of treatment is beyond that. And so I understood that as I was working as a dental hygienist. And so I stumbled across, the profession of dental anesthesiology, how the anesthesiologist would come to the office, provide the sedation, provide all the pain control mechanisms so the dentist can actually do the work. And so that really pulled on my heartstrings because a lot of patients will forego their dental care because they're just afraid,
Right.
or they forego the dental care because maybe their care is not in the scope of the regular dental office. They need to go to the hospital to receive their care.
Right.
So after doing that research, I understood that there is a need for a dental anesthesiologist, and I felt that I could fulfill that need.
Absolutely, and you're spot on because we don't want there to be any more barriers placed on people to be able to receive the care that they need. Right,
Yes,
oral health care is overall health care, and
yes.
any longstanding diseases or conditions that are not treated here, guess
Mhm.
what? They get manifested in other places all throughout your body as well.
Right.
So that makes sense. So let's dive into about the application because, like many residency programs and specialties, it's a process. And even though dental anesthesia is one of those specialties that are new in the sense that it's newly recognized as a specialty, it still is very competitive. It's probably less than 5,000 dental anesthesiologists, I'm sure. In the U.S., it's probably, I know it's less than that, and there's even less that look like us. So let's talk a little bit about your thought process and how you prepared for your application because you knew probably pretty soon within a year or two of dental school that you were going to be pursuing this path. So how did you prepare your application and your candidacy?
Yeah, I had a general idea as to what path I was going to pursue, and so, but my application was really truly organic. And I don't want to tell a long story, but I've I choose to serve in leadership roles because that keeps me It keeps me grounded. It keeps me organized. It keeps me involved. It keeps my mind focused on what I'm doing. If I don't do, these leadership things, then, my mind wanders and I can get off track, right? And so what I really captured in my application was organic things. Like I had leadership roles when I was a dental hygienist. When I came into dental school, I said that I'm really not going to do much in leadership. I'm just going to keep my head down and stay focused. But the bug bit me again. I started to wanting to get more involved. So it kind of kept me focused. So I did research at NIH. My research was on pain management. I presented that research at the American Dental Anesthesiology annual session. And so that's kind of introduced me to some people that, hey, gave me some guidance as to what the field is like and how I should go about pursuing the field of anesthesiology.
That sounds good. That sounds good. And I'm sure in addition to that, you did some homework. You looked at the what is it, 5 programs now? Was it 5 or 6 programs?
So
Uh,
there are eight programs in the U.S.,
okay.
but I externed at 4 programs.
So that's another way of being able, I mean, that you actually prepared your application by doing those externships as well.
Yeah. So the externships really gave me an opportunity to look at the programs over a course of a few days, so I can understand the relationship with the dental department in relationship with the hospital,
Yep.
and understand what the anesthesiology really does from day to day in their day-to-day operation.
And also that afforded you the opportunity to meet the actual stewards of the program, the faculty
R-
members, some of the actual residents in training as well, and they got a chance to meet you as well. So
Yes.
that's another way you all that are listening, considering dental anesthesia, not only right now, but in the future, uh, those types of externships, and it may be a little bit different now that we're still in this pandemic, but moving forward, I'm sure there'll be opportunities, if not person to person, but maybe some type of virtual externship or opportunities where you can learn a little bit more about how the programs operate. So let's talk about those programs. Give us an idea about the number of programs that you applied to and why you picked those programs. Like you said, we know there's 8 programs in the U.S. Uh, which ones did you apply to and why?
I actually applied to all 8. I applied to all of them.
Smart, strategic. There you go.
I felt so passionate about anesthesiology. I wanted to get in. So I did my research in every single program that's out there, even the ones that I really didn't get a chance to extern with. So I had an understanding what I was getting to as far as what the program can provide. I know all of them were CODA accredited, so my education is accredited through CODA. It was really based on picking the demographics where I wanted to be, what type of nuances you have at those particular programs, their difference between the programs and how they provide the education. Uh, and it's really those things in the relationship with the program directors and also the students that's there. So I had a chance to understand and to have a conversation with the students that's there, and they can tell me, they told me what the program was like for them.
Right,
So that
right.
kind of guided my decision as to which of the programs I would kind of rank in
Gotcha.
sequential order.
Got you. So after you apply to the programs, all 8 of them, usually the next step is hearing back from them to be invited for interviews. Tell us a little bit about the interviews that you got, and more specifically about the questions, especially the ones that may have been unusual, or maybe you heard one particular question that you didn't hear at the other programs.
Okay, yeah, yeah. So the questions they asked me were really based on my experiences. So they questioned me based on my CV that I sent to them. So they weren't necessarily unusual. There weren't questions that I couldn't answer. It was really trying to get an understanding of who I was and to ensure that the things that I have on paper is the things that I can articulate from from my personal perspective.
Now, based on that though, were there any other questions that were asked, maybe related to the specialty and some things about the specialty, some procedural things about the specialty that you're going to go into? I know I've heard from endo residents, and they've shared that sometimes they got some questions about endo prior prior to them even being accepted and getting into the program. So, just curious if any of the programs asked you any dental anesthesia related questions.
Luckily, they did not. They did not ask me any anesthesia-related questions, and so I didn't have to go through that. So if they asked me anything, it was how do I perform under stress? And I had those questions several times. It was always how do you manage your stress? How do you perform when you're in a stressful situation? Tell me about an instance in where you uh, the conditions weren't ideal. How did you respond to those types of things? How do you interact with your superiors or your attending faculty when you have one way of thinking, they have a different way of thinking? How you convey that to the patient? Make sure you have your ethical standards are intact. It was those types of questions that I had. It really wasn't anything related to, I don't know, how to place a LMA or endotracheal tube, anything like that, because I haven't done it before, and so I couldn't answer those.
Yeah, yeah. And you mentioned, a lot of the questions also came from your CV, your
Mhm.
experiences. Did they ask any questions about your research, especially the research that you presented at annual session?
So they did ask. They asked questions about the research, but
Okay.
it was really superficial. So they didn't go in and ask,
Hmm.
"What's your methods that you use when you're conducting the research?" It wasn't what like that. They really want to know, did I have an understanding of the mechanisms of pain, going from the PNS to the CNS, and things like that. Something very the average dental student could answer.
Gotcha, gotcha, gotcha. And those programs, you said you applied to 8 programs. How many interviews were you invited to?
So I applied to all eight, and I really thought I was going to get an interview at all eight, and I did not. So my
Okay,
ego was hugely it was deflated. I did receive interviews at three of the programs, though. Three of the programs that I applied to, I had
good.
interviews
That's
at.
that's 3 more than you had last year.
Yes, definitely. And they were all back to back during the same week, and so
Oh, wow.
as I prepared for one, I really was had the other one on my mind. I was like, okay, maybe because so they were different. So one of them asked for a video what I did over the pandemic and why do I
Ooh,
want to be an
a
anesthesiologist.
video. They wanted you to present and
Yeah,
present your answer in video format as to what you
in a
did over the
video
pen.
format.
Wow. Okay, that's
Yeah,
different. That's a different
yeah.
one.
And I kind of went over the top, and so I dressed up. I put on something similar to what I had on today.
As you
I had a
should.
PowerPoint, how I had a PowerPoint presentation available,
Yep.
and the video was recording me in the PowerPoint. I went over the PowerPoint after I finished that presentation. I shot a video at school while we were, working on our typodonts, and
Mhm.
that was included in the video. Had my family in the video, and it really gave a real personal touch.
That's good. That's good.
Mhm.
That's typically what's done when you're looking and seeking and being recruited for faculty positions at
Yeah.
schools and programs as well. Plus, you did the presentation before at annual sessions, so maybe there's some academia in the future for Dr. Lee. We'll see.
Hey, it's funny that you say that because that is actually on my radar. It's on my radar for
That's
sure.
good. That's good. We
Yeah.
need we need you in that space, man. We definitely need
Mhm.
you in that space. So let's talk about the the rank list because you got 3 interviews. So now you've got to put those programs in order based on some factors. What tell us a little bit about how you went about ranking the programs that you had to list prior to match.
So my ranking was determined based on the information that I gained from the programs, either during my externship or during the interview process. And so I decided to rank them based on my education I thought that I was going to receive because I wanted to receive the best education so I can be the best dental anesthesiologist. Right. And then I looked at the demographics or the location where I wanted to live. To be honest with you, I think they were in New York, so I was really destined to be in New York. I had no other choice. So it's just what part of New York that I wanted to live in, and so that's how I chose my rankings with that information, education wise, and also demographics where I wanted to live.
Gotcha. And so you put them in order. Match day comes. So now you gotta tell us where you match, where you're going to be taking these talents to in July.
Sure, I'm taking my
Drum
talents.
roll, please. Where's the drum roll? Where's the drum roll?
Here we go. Just like LeBron in 2008, right? So I'm taking my talents to St. Barnabas Hospital.
St. Barnabas, yes.
Yeah, yeah. I'll be in New
Congratulations.
York.
You be in New York. That's awesome. Awesome. Dr. Badner. Dr. Victor Badner.
Okay.
He is the chief of dental services at St. Barnabas. Um, and I'm not sure, but maybe anesthesia might be more on, even though it's dental, they may have a different division within the dental department there. I'm not sure, but Dr. Badner is the chief of dental service. You'll be up there with him and all his colleagues, and now they're going to be your colleagues as well. So
Yes.
that's great, man. Congratulations. Congratulations.
Thank you so much. Thank
So
you.
happy for you, man. Advice, tips. This is the part where hopefully everyone you've been listening all the way through. That's why I tell you, you got to listen all the way through. Got to keep your attention span because now you're going to get the some additional gems, tips, and advice for those dental students or even recent grads that are considering dental anesthesia as a specialty and as a profession. What would you say to them?
My best advice is to really explore the profession, to get an understanding of what you would do if you were practicing as a dental anesthesiologist. And so there's several ways that dental anesthesiologists practice, right? So they have mobile anesthesia. You can practice in the hospital setting. You can go into academia. Those are really the three pathways in which you're most likely to choose. So if once you understand how you practice, then you can get a greater appreciation of the programs in which you're applying to. So some of the programs have more of a mobile-based education process, right? I'm not going to name them at this point in time, but some of them have more of a mobile-based focus. Other programs, you practice your residency is alongside physician anesthesiologists, so you're getting trained the same. You have the same training as the physician anesthesiologist. But would you consider yourself to be a dental anesthesiologist to practice in a hospital setting? If you if you're not looking forward to the hospital setting, then you may want to choose a program that has a focus maybe on mobile anesthesia or have a focus maybe on academia as opposed to the hospital setting. Those are things that you want to look at prior to even applying to the programs. And then the next thing I would say, so how would you set yourself apart from all the other applicants because it's so competitive? You should focus on the things that make you a better candidate. Those things that make you a better candidate, though, it should be things that you enjoy. I chose to do research because I kind of have a fondness for the research. I want to gain the understanding why am I doing something, not just to do it. So that's why I did research at NIH, right? That research at NIH kind of gave me a little boost because that research I presented at the dental anesthesia conference in Vegas. And so it's different things that you can use, that some nuances in the application process that you may not be thinking about, but you should be thinking about on the back end. Like, how do you plan to practice? The way you plan to practice should determine which program you actually apply to and want to get accepted to.
Oh man, awesome. I mean, definitely spot on. Awesome tips and advice, and you're so right. You got to focus on your strengths, but also do your homework and explore what those options that are currently in the profession. I've interviewed one of your colleagues that I'm hopefully will get you in contact with, Dr. Braxton Henderson, who did his program undergrad at Pitt, dental school at Pitt, and then he did dental anesthesia at Pitt as well.
Yeah, yeah.
He's in the I think he's in the Charlotte. I think he's in North Carolina area. I could be wrong, but he has a mobile practice, right?
Hmm. Yeah.
And I'm pretty sure his selection of his program was based on how he envisioned practicing in the profession after residency as well.
That's
But
correct. I
again,
spoke with him
uh,
a while ago.
okay, yeah,
Yeah.
I thought you did. I thought you did.
Hmm.
Yeah, there's like I said, there's not many of us that
Yeah.
look like us in the profession. But I know he's also very interested in making sure um, that everyone is connected or gets connected within this specialty group as well. So
Mhm.
so glad to hear that you connected with him, and also so glad to hear about your success, man. Thank you so much
Thank you.
for sharing your success. What's the best way for people to get in contact with you if they have questions?
Sure. So I'm on most of the major social media platforms. If you want to keep it professional, you can contact me on LinkedIn. You can find my name. It's Lee Goodloe. I'm on LinkedIn. Instagram, a little bit more fun. And so my name on Instagram is Dog, DAWG Lips, Dog Lips on Instagram. You can reach me by email if you would like to. So the email is contact at l7dentalconcepts.com. So those are the primary ways you can reach.
You guys can check that out down below. And again, thanks so much. You've been a great resource. Guys, check out these other videos here. Hopefully, these will be a resource for you too. And that's our time. Love, peace, and smiles. See you on the next video. Shout out to the bros, Omega Psi
Rue.
Phi. Rue.